Thank you for joining. I'm Dr. Kelly Vaughn, founder of Restore in 24 Dental Implants, and I will be sharing with you some information about the possibilities with dental implants. Dental implants can be used to replace a single tooth if you're missing only one tooth, or a segment of missing teeth using multiple implants. But today's presentation will focus more specifically on a fixed replacement of all teeth using dental implants as an alternative to dentures. You'll find this presentation useful if you currently wear dentures or if you've been told you're heading toward a denture and you know that you do not want a denture. Maybe you suffer from periodontal disease, which is also known as gum disease and loose teeth, or broken down, decayed teeth that are beyond restoration. Or maybe you've experienced the cycle of failed dental treatments that never really seem to reach your expectations in terms of function, aesthetics, and comfort, and you're just looking for a more permanent solution. This presentation will help you gain a better understanding of what dental implants can do for you. The presentation will last about 30 minutes, and I'll show you some real patients, several before and after pictures, and explain how these incredible results are made possible with dental implants. I'll also cover the costs and then any discounts that are available for this treatment. I'll also be reviewing a special offer at the end with an opportunity to make priority booking for a consultation. It's important to understand that this presentation is of a general nature. So if you feel this is the best solution for you, you really need to see one of our doctors for a consultation to determine if you are a candidate for this procedure. This is all about a procedure that changes lives. To crunch into an apple, taste the juices without feeling pain, instability, or weakness, this is what most of us take for granted. But it is the very basic indicator of the quality of life. And it is something that most people I've come across who wear dentures or those who have fragile teeth, they're missing out on that quality of life. If you find yourself avoiding dinner with family or can't enjoy a healthy diet because of ill-fitting dentures, or maybe you just want to be able to bite into a juicy cheeseburger and enjoy a night out on the town with friends, the inability to do these simple activities is holding you back from living your best life. Just like in medicine, the purpose of any dental treatment should be to improve quality of life by restoring function and appearance. And that's exactly what Restore in 24 does, and it can be done in as little as 24 hours. Now, as I mentioned earlier, an implant can be used to replace a single tooth, or multiple implants can be used to replace a segment of missing teeth. The focus today is on Restore in 24. Now, Restore in 24 is an all-on-X procedure. The most common term for this is all-on-4. The reason for this is if 4 implants are placed, it's called an all-on-4. If 6 implants are placed, it's called an all-on-6, and so on. So the X in all-on-X represents the number of implants being placed. For simplicity, I will refer to it as all-on-4 for the remainder of this presentation. There are basically 3 components to the implant system. First, there's the implant, which is inserted into the jawbone to serve as an anchor for the teeth. Then there is the abutment, which is the intermediary connection between the implant and then finally the prosthesis or the teeth. Implants have been around for centuries. They've been made of wood, ivory, and not until the 1960s were they really for the mainstream. In 1952, researcher Dr. Bronnemark discovered osseointegration with titanium. Osseointegration is when the cells of the bone attach themselves directly to a titanium surface, essentially locking it into the bone. Then in 1965, Dr. Bronnemark and his team placed the first titanium dental implants. The patient had a cleft palate, and Bronnemark's team placed 4 titanium implants. Following the successful osseointegration process, they attached a removable denture to the implants, restoring the patient's function. This was a multi-stage process requiring implant placement, healing for several months, and then a second surgical procedure to uncover the implants, then several other appointments to place the attachments and fabricate the dentures. The multi-stage approach could take up to 12 months to complete. In 1998, building on Brodemmark's research, Dr. Malo, with Nobel BioCare, devised a new concept known as the all-on-4 treatment concept. What he discovered is that by tilting or angling some of the implants, it was possible to avoid certain critical anatomical structures, like the sinuses in the upper jaw and the nerves in the lower jaw. It also allowed the implants to extend a little farther back where there may not be adequate bone to support a traditional implant. As you can see here, this is a panoramic radiograph of a patient that had all-on-4. You can see that the most posterior implants are angled. The blue lines represent the sinuses and the red lines represent the nerves. By angling those implants, those structures are avoided. We keep referring to this as all-on-4, and a question I get asked a great deal from patients is, aren't more implants better? Well, the short answer is not always. This procedure is based on 4 because really that is all that's needed. But as I tell all of my patients, more is not always best, and the reason for this is we want this to be cleansable. Sometimes more implants can lead to bulky designs and implants being placed too close together and you can't keep it clean. So we want the implants to be spaced in a way that there is ample room between the implants so that you can easily clean underneath the teeth. In this image, you can see there are actually 5 implants, so this case was an all-on-5. And you can see the implants are nicely spaced. When placing the implants, the first thing considered is where the quality bone is, then the spacing is considered. The goal is to be able to design teeth that are easy for you to maintain. The part that touches the gums should be smooth and have enough space between implants for easy access with superfloss, and you should be able to irrigate under it easily with a water flosser. At Restoring 24, we place up to 6 implants per arch, but it depends on the amount of bone you have so that they can be spaced as needed. In 2005, this concept got really exciting because the FDA gave clearance for immediate function, meaning implants can go in, teeth are placed, and you begin using them that very same day. So instead of having to heal in a denture for half a year or more, you could get fixed teeth immediately. Now, how is this possible? It's possible because there is a rigid framework anchoring all of these implants together, providing reliable group function and the distribution of the forces. How is the framework done? This is how it used to be done. A lab would make a denture prior to implant placement. Then you would cut holes in the denture and then use temporary cylinders to attach to the implants. Then you'd come back in, backfill those holes that were made. So we are retrofitting a pre-made denture to the newly placed implants. Now, what does this mean? It means the structure is weak and can easily fracture or break. Now the rigid structure that is supposed to provide that reliable group function and distribution of forces is no more, and this can be detrimental to the success of the implants. Even today, there are many offices that do it this way. Why? Because they don't have the technology or ability to create same-day or next-day teeth. Now we have machines that can make a solid set of teeth fit precisely to the implants due to the technological advancements in CAD/CAM, which is computer-aided design and manufacturing. It's made this process so much more efficient and cost-effective. You can see on the left, this is what the CAD/CAM technology looked like decades ago. It takes up an entire room and was very costly. Now, the image on the right, this is actually one of my units. It's about the size of a refrigerator, takes up very little room, and is more cost-effective. And because of this, I can have multiple units. This unit pictured, it's used to mill out our titanium frameworks that we use in our Dreamline product. Now we have these advancements in smaller units, so we need somewhere to house all of this new technology. This is why in 2020 I built a brand new facility. It was purpose-built to enable the delivery of a solid and rigid fixed set of teeth within 24 hours, with on-site 3D imaging, a full on-site digital lab, and production facility. And today, as well as every day since, we are constantly looking for ways to improve the entire process, making it better and more efficient. This is just some of the technology. We have 3D printers, design software that helps us create the new smiles, milling units that cut out all the framework and the crowns. And then I have an amazing team that hand finishes it all. Now I'd like to take a few minutes to review some cases that fall into the categories we went over earlier, those that would benefit from this procedure. The denture wearers, those suffering from periodontal disease, those suffering from severe decay, and those that are tired of throwing good money at bad teeth with failed dental treatments. People that have suffered from loose or uncomfortable dentures can be almost instantly rehabilitated with fixed teeth. This is Janice. She had been in an upper full denture for approximately 7 years, and she avoided eating out with friends and family because, in her words, I was tired of eating soup. You can see here her upper teeth, they're barely visible, and she's lost what we call vertical dimension. The lower third of her face appears collapsed. She's overclosing, and her nose appears to be a little more pronounced. This is a good representation of what happens as bone is lost. You can see the bone deteriorates over time. The red lines indicate the amount of bone loss, and you can see where the teeth once were. This is what happens when there's not something to stimulate the bone. It's just like weight-bearing exercise is good for the health of your other bones. Implants help stimulate the bone, and they help maintain healthy bone for the future. Here's another denture wearer. This is Amanda. You again can't see much of the upper teeth. She's also lost that vertical dimension. And for her, she had a very hard time tolerating the roof of mouth coverage that a denture comes with. This shows what an upper denture covers. The soft area at the back of the roof of the mouth, that's where a denture needs to extend if there's to be any hope for retention. And even then, adhesives are often required. This is why so many can't tolerate an upper denture, because it can trigger the gag reflex. Here's Amanda again. And from both of the denture cases, you can see we aren't just building back teeth, we are building back the facial structure by building up the gums. This often gives a much more youthful appearance. You can see from this gentleman's profile, we are able to not only replace the teeth, but also the gum structure. You can see here, we're able to build up and add 18 millimeters of facial structure that was lost from long-term denture wear, restoring more ideal facial proportions. This is a panoramic radiograph of a patient with severe periodontal disease or gum disease. When she came to see us, her teeth were mobile. In addition to the teeth being mobile, she has bleeding gums, pain, and discomfort. Gum disease is the leading cause of tooth loss, and it can be attributed to lifestyle choices like smoking or poor oral hygiene, but it can also be linked to health-related issues like autoimmune disorders or uncontrolled diabetes. And here's the after image, an incredible difference. The teeth were removed, all the infection cleaned out. Now she has something she can easily clean and maintain. This is Dawn. She's dealt with the cycle of failed dental work, and this is her panoramic image. She has failing crown and bridge work, decay under fillings that would now need root canals and crowns, missing upper teeth requiring a partial, but now she's lost a front tooth as well and is looking for a permanent solution, and she knows she does not want dentures. And here she is after. She's such a fun person, and now she can put her best self forward. This is Josh. The majority of the teeth are severely decayed, and there's really not enough tooth structure to restore most of them. He had some dental issues when he was younger, and it just continued into adulthood. And when he came to see us, most of the teeth were just too decayed to save. They were crumbling, and his fear was biting into something and breaking off teeth. He was embarrassed and had perfected hiding his teeth when speaking to people. He's young, and he knew he didn't want dentures because he understood that without something in the bone stimulating it, like implants, the bone would continuously resorb or melt away. We placed 4 implants in the upper and 6 implants in the lower arch. Gave him a brand new smile. He's more confident now in social situations, and he told us that his wife stared at him the entire drive home, said she couldn't take her eyes off of me, and it's a 3-hour drive. Here's another case with broken down and decayed teeth. Dental decay is one of the major factors leading to tooth loss. It's caused by a number of things, but one of the more common causes is soft drinks and energy drinks. Soft drinks have always been an issue, and now energy drinks are more popular than ever. A benefit for the people dealing with severe dental decay is that dental implants are not susceptible to decay like natural teeth. Here's the after image. Something to note, you don't have to have both arches done. In this case, he only needed the upper arch done because his lower teeth were in pretty good shape. And as you can see, even by just doing one arch, the results are amazing. So if you're struggling with poor teeth or loose dentures, the first thing to do is make an appointment for an implant consultation. At that appointment, we will determine if you are a candidate for All-on-4, explore your options, discuss the fees and financing options, and provide you with a written treatment plan that you can take home and discuss with your friends or family. If you decide to proceed with treatment, we will find a date that works with your schedule to bring you in and get the records needed to design your new smile. We will take photos, get some measurements, some digital scans, and then review all of the details of the treatment and make sure you have the necessary prescriptions for treatment day. We offer 2 types of anesthesia: IV sedation provided by a certified nurse anesthetist and conscious sedation. Most patients choose the IV sedation. If teeth need to be removed, all of the teeth are removed and then the implants are placed. We then use the previously made smile design with digital information obtained during surgery, and that allows us to record the exact location of the implants placed. All of that information is then sent to our lab, just upstairs, and they begin the design and fabrication of the new teeth. And then, within 24 hours, the big reveal. The new teeth are inserted, and you can begin using them that very day. The healing period for implants to anchor is about 90 days, and during that healing period, you'll be on what we call the plastic fork diet. Anything you can easily cut with a plastic fork is on the menu, things like fish and pastas. We'll then bring you in, check the health of the implants, see if there are any changes you'd like to make to your new smile, and also scan the tissues to ensure that your final teeth fit the gums properly, because the gum tissues will have changed since surgery day. Hopefully, you can see the benefit and have a better understanding of All-on-4 and Restore in 24 dental implants. The fees for this procedure average around $20,000 per arch, and there is a rebate if both arches are done at once. The fees are all-inclusive, covering removal of the teeth if needed, up to 6 implants per arch, simple bone grafts, and of course the new teeth. The only other fees would be if you are in need of additional procedures to lay the groundwork for the implants, meaning you have so little bone that we have to add large bone grafts. These procedures may add time to the overall treatment because the bone grafts require their own healing period. It's to allow time for your bone to fill in and become dense enough for the implant placement. All of this will be covered during the consultation, and you will always know the fees prior to treatment, so there are no surprises. As promised, we have a special offer for everyone watching this webinar, and for anyone considering this procedure, I encourage you to take advantage of it. The consultation for this procedure is valued at $500, but we are offering it for free to everyone watching. At the consultation, we will take 3D x-rays of your jawbone, evaluate the quality and quantity of the bone, and determine if you are a candidate for Restore in 24. You'll meet with an actual doctor. We'll discuss the options available to you and answer any questions you may have. We'll also provide you with a smile simulation photo so you can see what your new smile could look like. And you'll walk away with a better understanding of the whole procedure and be given a quote for the treatment. To summarize, Restore in 24 is an all-on-X procedure. By using just 4 to 6 implants, an entire arch of teeth can be replaced. It is a fixed solution, meaning only your dentist can remove it. It's an excellent option for denture wearers and those suffering from bad teeth or failed dental work. It restores function and appearance. It eliminates the gag reflex caused by dentures, and because it uses implants, it helps maintain healthy bone. If you have any questions concerning what's been discussed today, or you'd like to take advantage of the free consultation offer, you can reach the Restore in 24 team by chat or by calling 678-293-8778, or by visiting our website at www.restorein24.com and filling out a form. We are always happy to help in any way we can. Thank you for tuning in, and we look forward to hearing from you soon.